Good afternoon. I am doing my policy research on the Affordable Care Act, and I'm specifically focusing on the Medicaid expansion. Now, the Affordable Care Act was enacted in 2010 under President Barack Obama. This was to provide universal health care to Americans through a series of mandates, subsidies, and the Medicaid expansion. People were able to get health care through still the private marketplace, but there was also a new public marketplace where you could receive your health care. Some people refer to this as Obamacare, but it's a little bit cheaper option for people that have limited income. So what I'm going to be focusing my research on is risky health behaviors that are associated with the Medicaid expansion. Now, a lot of the scholarly research that I've looked at has suggested that risky health behaviors have increased, such as smoking, drinking, and overeating. My policy and what I'm going to be researching and suggesting is that the BMIs of individuals in states that have expanded their Medicaid coverage have increased. So that's my goal here. I'm not going to focus on all the other stuff, just really narrow down on BMI and how many obese people are in that state, how many were there prior to this, and I think that maybe we can come up with a good answer as to does Medicaid expansion actually have a more negative term than some people think. So what my model is going to be is I'm going to have a demand model, and I'm going to have health care on the y-axis, and I'm going to have food on the x-axis. And then I'm going to show the budget constraint before, and then the budget constraint after the Medicaid expansion was enacted, and show how people have more money to freely spend on food than they did on healthcare, because now they're not spending as much on healthcare. So I'm going to shift the budget curve or constraint out to the right. I'm also going to show an indifference curve just to show that there's a higher utility for food now than there was prior, because people are able to spend their money on that, so they're going to. And what I'm going to hopefully get out from this model is that people have more money to spend on these things, so they're going to do it. So that in turn is what increases BMI and increases the habits of overeating and just that people have more money to freely spend. Now, the data that I'm looking at is from the BRFSS telephone survey, which is a telephone survey that goes out to individuals, and there are a few issues with that, one being that not everybody has access to a phone, but a lot of people actually take the time to do these surveys, so it's pretty widely accepted method of data research because it does get to a large amount of people. So the BRFSS has done this for many years, and there's been before and after the Affordable Care Act was enacted. So we can really tell a trend based on that, just answers that people give, and in hopes that everybody will give the correct answer, and we'll be able to see from that what if obesity has increased, if BMIs have increased, if just in those states that have expanded Medicaid coverage. Now, I am going to look at states that did not expand and see where they kind of lie as well. Maybe there's some underlying factors as to why that BMIs have increased, but solely really focusing on the states that have expanded their Medicaid coverage, and maybe is this too far of a jump for the country to be seeing at this point. I'm also going to look at some data from the CDC, which they have a lot of information about BMI and the health of the overall country, and you can break it down by state. So I'm going to look at that and just see if there is if BMI has increased over the states with the expansion and the states without the expansion. You can hear in the news a lot today about BMI increasing, and we have overweight children, and so I'm going to try to tie in and see if there are some factors there that relate. But so far, the data has suggested that yes, BMI has increased exponentially in states with Medicaid expansion. Because people have more money to spend freely. But, we have to really dive a little bit deeper into what that all entails. And so the data does suggest that so far, but I'm going to do a little bit farther research to just see exactly what is going on there. But Thank you so much for your time. Thank you for listening, and I'm excited to present my final project to you. Thanks.